Okay, I will start with Group 7. Our group member consists of Reena, Tina, Vaidehi, Satya, Tula, Fahad, Kiramai. And this presentation is brought by me, Jack, Siminashi, and Kaviya. The topic we're going to present today is hemorrhagic disorder due to chronic liver disorder. And the second part is myoproliferative disorder. Okay. Now, actually, touch on the topic of hemostasis, where the mechanism is to maintain blood between the vessels and to arrest of bleeding following injury to vessel wall. This is the hemorrhaging issue, right? So basically, we are doing prevent hemorrhage, is doing clotting, and to prevent intravascular coagulation, breakdown intravascular clot, we are doing anti-clotting. Okay. In the lecture, doctor has said that bleeding disorder, we have 4 kind of category: DIC, clotting factor abnormality, platelet disorder, and vascular abnormality. And using this as a test, right, to show the bleeding disorder, right? And this is where I'm trying to bring you to this pathway, where you can see here, denoted by the PT, APTT, all this. Later you will see what the pathway, how the pathway come about. And again, what is the function? Hemostasis is to support what the other function, including support metabolism of injured intima and maintain vascular integrity, humoral control of inflammatory reaction, thromboglobulin, and immune healing. We touched on again, just now we mentioned about the extrinsic and intrinsic pathway, where you can see how it comes in, how the the role of platelet in clotting, using the extrinsic pathway, intrinsic pathway, and common pathway. These are all the terms that you can see so many numbers and what they do, fibrinogen. Yeah, it's so complex. Further, so this is to avoid your questioning what is about, what are all this numbering about. It's actually the pathway and the, okay, and we have a common pathway here. Now, again, coming back to classification disorder, platelet disorder. Again, remember this part, right? And later you will see how it comes to the liver hemorrhaging. And we can classify under quantitative and qualitative. Okay, we are touching more on here. Decreased production, increased destruction. Okay, now we see how the liver physiologic function of the liver. From the normal liver, after undergoing the chronic injury, due to alcohol disorder or this disorder, and then it become inflammation, and then they start fibrosis. And again, in this long period of continuous factors like destructive factor like obesity, alcohol, or genetic, then it is going to be getting worse, lead to cirrhosis. Okay. Now, if this if you can cure, you can come back, right? If not, you go further. And at this stage, the terminal part is either you either do liver transplant or you get carcinoma. It's the cancer. Okay, now let's come to this part where you can see all this numbering is the decrease of the platelet function. It's actually to tell you the bleeding through these factors, the abnormality. Okay, can read here, the liver play a central role in the clotting process. Both acute and chronic liver disease are invariably associated with coagulation disorder. Okay, coagulation due to multiple clots, and also a decreased synthesis of clotting and inhibitor factor. These are the factors. Okay, decreased clearance of activated factor, quantitative and qualitative defect. Just now I mentioned quantitative or qualitative, and hyperfibrinolysis, and accelerated intravascular coagulation. These are all the factors that cause the bleeding. Okay. Okay, trying to show you. Okay, further to that, how this factor can be destructive. If we can read here is the biliary obstruction result from all this vitamin K, absorption vitamin K, and then decreased synthesis of factor 2 and all this numbering. Then with severe hepatocellular disease, okay, it also cause deficiency of this factor, and they often reduce the level of this fibrinogen. Okay, when you mention deficiency, that means it go down, decrease. Huh? And then functionality of fibrinogen is found in many patients. Okay, this fibrinogen. And decreased thrombopoietin production from the liver contribute to thrombocytopenia. Okay, Dr. Ye mentioned this in the lecture, if you remember the slide. Hypersplenic, this is spleen. Okay, hypertension. And disseminate intravascular coagulation may be related to release of thromboplastin from damaged liver cell and reduced concentration of antitrophin, protein C-A2 antiplasmin. In addition, there is impact removal of activated clotting factor and increased fibrinotic activity. Okay, so the net hemostatic imbalance in liver disease may be prothrombotic rather than hemorrhagic. So it has evolved from hemorrhagic to thrombotic if the imbalance of the disease continues. Okay, this is talking about the hemorrhagic disorder due to chronic liver disorder. Now, next we go into myoproliferative disorder. Okay, as the name implies, it's a kind of proliferation from the stem cell to, stem cell it break into two lineage, right? One is myeloproliferative and the other one is leukocyte. Then the myeloproliferative site disorder will lead to 4 kind of disorder. Okay, and this disorder will be explained by the next speaker, Nashi. So I make a brief introduction. Okay, so for these are the 4 myeloproliferative disorder classification. We basically have CML, PV, EAF, and ET. Okay. Okay, CML is affecting the middle-aged people. Okay, chronic myeloid leukemia. So it's distinguished from other neoplasm by the presence of this BCR-ABL gene. Okay, this exam may come up. Huh? If you see CML, you see this gene. Derived from portion of the chromosome 22 and 9. Okay. So it's 22 chromosome 22 and 9. So two factor now. One is BCR-ABL gene. The other one is chromosome 22 9. Okay. So to check on this, you use bone marrow biopsy showing hyperplasia of this cell and this cell, megakaryosis. Okay, and then if you can detect, you can also detect the Philadelphia chromosome. Okay, linked to this to 22 chromosome 22, and then when they mutation, then you can see the Philadelphia chromosome, and you can check by using conventional cytogenetics and fish. Okay, because this was discovered in Philadelphia. That's why they call it Philadelphia. Okay, so in short, CML linked to what? To middle age 25 to 60. Okay, linked to PCR ABL gene, linked to chromosome 99, 22, 9, linked to Philadelphia chromosome, discovered by fish. Okay, and then look for what? The biopsy at bone marrow, look for meiosis, megakaryocytosis. Okay, the second one is PV, polycythemia vera, PV. Okay, PV, yeah. Just now CML, right? This one is PV. Now, PV, you look for what? You look for this JAK2. Okay, so remember, JAK2, this is the common question asked. It's linked to tyrosine kinase. Okay, so what it do is this JAK2 mutation sharply lower the dependence of hemostatic cells on growth factor for growth and survival. Okay, produce excessive proliferation of erythroid, granulocytic, and megakaryocyte. Okay, remember the myeloid lineage when you come to this part. Okay, these are the end. You know, from the blast, then reach here. Then bone marrow biopsy showing hypercellularity for age with clinage and endogenous enteric colony formation in vitro. Okay, now this for PV, remember PV? Remember JAK, okay, JAK2 and JAK2 mutation. Next comes to PMF. PMF myelofibrosis, okay, fibro. The hallmark is to look at this obliterative marrow fibrosis. Again, it's also caused by JAK2. JAK2. Okay, now we have PV, PMF also look for JAK2. And no evidence of bone marrow failure due to underlying inflammatory and other increase in serum lactate. And this is anemic. It's anemic. Okay, so for PMF, remember JAK2, anemia. You look at the platelet count. Remember just now the platelet count is between this range 450 times 109 during World Cup period. And more common, these are OH people. The first one is talking about CML, 25 to 60. But for ET, remember the ET is for old people, over age of 50. So abnormal excess platelet may not function normally, leading to abnormal clotting or bleeding. So bone marrow biopsy, again, the bone marrow biopsy, you're showing confusion mainly on the megakaryocytic lineage with increased number of enlarged mature megakaryotes. Okay, megakaryote. Remember just now PMF? Oh, not PMF, EPMF. Okay, for PV, it leaks to here, right? Erythroid, granulocytic, megakaryotic. But for ET, it only leaks to megakaryocytic lineage. Okay. So remember this blast, right? This cell. A small number of patients may develop acute leukemia or a bone marrow disorder called myelofibrosis. Okay, again, ET for old people. Okay, and what cell? Megakaryocyte and leukemia, acute leukemia. There is one is anemia, right? PMF is anemia. Okay, these are the four classification. Next, we have what causes polycythemia? Polycythemia anemia vera. This is again. Remember this slide. Okay, JAK2 mutation. Okay, and this the cell lineage, and the next speaker will explain further. Minashi, are you there? Minashi?
Good morning, sir.
Yeah. Okay.
Good morning, doctor.
Yeah. I can't hear you.
Doctor, one second.
Yeah, Minashi, you can start. I cannot hear.
One second. One second.
Minashi, are you there?
One second. Good morning, doctor. This is Kavya Suryaprakash.
Morning.
Doctor, I'm here to explain about polycythemia. And this polycythemia is actually called as polyglobulia. It is a disease state in which the hematocrit is elevated. The hematocrit is actually the volume percentage of red blood cells in the blood, and it is classified into two as primary and secondary polycythemia. This primary polycythemia is generally a genetic disorder and most commonly caused by a mutation in the bone marrow cells, which produce your own red blood cells. And this secondary polycythemia is absolute increase in red blood cell mass that is caused by enhanced stimulation of red blood cell production. And for example, this polycythemia is mainly due to factors external to the red blood cell production. For example, hypoxia, sleep apnea, certain tumors, which results in polycythemia. Actually, this sleep apnea is a potentially serious sleep disorder in which breathing is repeatedly, it begins to stop and start. If you snore loudly and feel tired even after full night's sleep, you might have sleep apnea. And next about polycythemia vera, and it is a blood cancer. It is a blood cancer that begins in the bone marrow of your bones, in the marrow of your bones, the soft center where the new blood cells grow. Next, primary, familial, and congenital polycythemia. It is mainly caused by genetic mutations, increased responsiveness to normal levels of erythropoietin. Next is about secondary polycythemia. It is caused by increased erythropoietin production, either in response to chronic hypoxia or from an erythropoietin secreting tumor. This chronic hypoxia is a lung damage due to trauma. Other things can cause hypoxia include lung disease such as chronic obstructive pulmonary disease, COPD, and hypoventilation syndrome, chronic heart diseases. Next, erythropoietin secreting tumors. Certain tumors can release an increased amount of erythropoietin. The most common erythropoietin secreting tumors are liver cancer, hepatocellular carcinoma, kidney cancer, renal cell carcinoma, adrenal adenoma, adenocarcinoma, and uterine tumors. Next, the clinical features of polycythemia vera are headache, dizziness, shortness of breath, weakness, problems breathing while lying down, and the diagnosis for polycythemia vera. To diagnose polycythemia vera, your doctor will perform a test called complete blood count to see if your number of blood cells is higher than normal. Your doctor may also test your blood to look for amounts of hormone called erythropoietin. Lower than normal levels of this hormone can be a sign of polycythemia vera. And the laboratory findings of polycythemia vera include complete blood count tests, other blood tests like blood smear tests, erythropoietin level we have to check, and bone marrow tests. Next, Meenakshi will continue, doctor. Thank you.
Good morning, doctor.
Morning.
Essential thrombocythemia is essential thrombocythemia is a rare chronic myeloproliferate disorder. It is characterized by the overproduction of platelets, thrombocytes by megakaryocytes. Clinical features of essential thrombocythemia. It is mostly asymptomatic during diagnosis.
Connection problem.
Development of blood clot, most often in nose bleed and bloody stool, bleeding of mouth, gums, blood double, tingling in hands and feet. Laboratory findings of essential thrombocythemia. Complete blood count and peripheral blood smear shows large platelets, megakaryocyte fragments, and platelet aggregates. Primary myelofibrosis. It is a rare chronic disorder. It is also called chronic idiopathic myelofibrosis. When myelofibrosis occurs on its own, it is called primary myelofibrosis. It is considered as a form of chronic leukemia. It is a disorder in which normal bone marrow tissue is gradually replaced with a fibrous, scale-like material. Over time, this leads to progressive bone marrow failure. When the chemicals is released by high numbers of platelets, an abnormal megakaryocyte overstimulate the fibroblast, which results in overgrowth of thick coarse fibers in the bone marrow, which gradually replace the normal bone marrow tissue, which prevents the production of adequate number of red cells, white cells, and platelets. So it can occur at any age, but it is diagnosed between 60 to 70 years of age. So this is mainly caused when the long-term exposure to high levels of benzene or high dose of ionizing radiation may increase the risk of this case. The cause of primary myelofibrosis has not been determined. Although myelofibrosis is not inherited, it is not basically inherited, it is associated with the DNA changes in certain genes. The proteins are called genus associated kinase. As Uncle Jet said, the JAK, which plays a major role in the myelofibrosis. JAK regulate the production of blood cells in bone marrow by signaling the cells to divide and grow. If the JAKs become overactive, too many or too few blood cells will be produced. Signs and symptoms, the clinical features. Anemia, pale skin, enlarged spleen, portal hypertension, night sweats, dilated veins in the stomach and esophagus, and even frequent infections may cause. It also has low platelet counts, immune abnormalities, hypermetabolic states, hematopoiesis bleeding, uh, even weight loss, extramedullary hematopoiesis. Diagnosed by it is diagnosed by which number of blood cells may suggest this myelofibrosis. Even gene mutation analysis, bone marrow biopsy, imaging tests are done to diagnose the primary myelofibrosis. People with primary myelofibrosis have been previously diagnosed with polycythemia or essential thrombocythemia. The treatments, there are various treatments for this primary myelofibrosis, which depends on the patient's symptoms and their circumstances. Some people may exhibit the symptoms, the clinical picture which I said before, but some may not. But they'll not require immediate treatment. Since they are diagnosed at the age of 60 to 70 years. For the most of the patients, they suggest Jakafi, which is the first drug approved by the Food and Drug Administration for the treatment of intermediate or high-risk myelofibrosis. It is a multikinase inhibitor that works to suppress overactive Janus-associated kinase JAK signaling. It is taken orally. It this disease like enlargement, spleen, night sweats, itching, weight loss, fever. Scientifically, it cannot be prevented, but allogenic hematopoietic cell transplantation may be a Asian immune system with that of a suitable donor. This new immune system myelofibrosis patient as well as provides healthy blood-making bone marrow cells. Immediately before the transplant, the patient must undergo chemotherapy or radiation therapy to suppress the patient's immune system. Cells from the donor will take HCT, carries a high risk of and is only suitable for certain patients. The risk of a complication is higher for the medical conditions. So let me say again, what is the essential thrombocythemia? It is a rare chronic myeloproliferate disorder which is characterized by granulocytes in the bone marrow. And a primary myelofibrosis is a disorder in which normal bone marrow tissue is gradually replaced with the fibrous scale-like material over time. This leads to progressive bone marrow failure. Thank you.
Thank you, Dr. Ye. You are there?
Hello. Can you hear me? Hello.
Yes.
Oh,
Yes.
sorry, I mic down off. And tomorrow, you can be happy. You have no MECOS exam tomorrow because of they don't wanna do open book or something, so that I think they will be postponed and the MCQ lift, and then they will combine MECOS exam after doing pharmacology or something. I'm not too sure. After doing pharmacology block, I think they will do MECOS and ANCOS for pathology, or they can use other words. They can use one is your mid semester break. I think they will use your mid semester break. I think one is your mid semester break after pharmacology, right? After pharmacology. Hello. One is your
yes, Doctor. Yes.
mid semester break after pharmaco, right? I think they will use mid sem break for pathology exam. I think for OSP 1 day. OSP and mid course can be 1 day, and end course will be 1 day. I think. I'm not too sure, but they will use the. They tell me they will use the mid course. Not only you, we are also postpone.
So tomorrow, no
exam. No exam. You can relax. No exam. No exam. So they will use your mid semester break for exam, but for end course or spear and mid course, I think.
Okay.
After pharmaco, right? After pharmaco is mid semester break, right? Right? After pharmaco,
Yeah.
right? Sham, where's Sham? After pharmaco, right?
Yeah.
Yeah, I think they were used because so other university we also they haven't do for online exam yet, so we need to wait, and then we need to adjust with other university also. I think.
Okay.
Online exam they haven't do, so we not open. Please open camera first. I want to take picture, then I will continue with some MCQ discussion. Open your camera, please. You share pass and check. Hashin never open the camera. Why? I don't understand. Hashin never open the camera.
Abhishek open it.
I haven't showered yet, Doctor.
Hashin, why? Too shy. Check open. Web pen. Any file cannot join video. Error. Wait, Sham, why you cannot open the camera?
Sham feels shy, sir.
Shy. Oh yeah, Tanusha only open. Okay.
So I just woke up. I don't want, sir.
So another person when I open anywhere where Kuhan cannot Kuhan only Kuhan and Melissa, Yu, G. Where Yu sometimes open Yu, Melissa, no, I haven't seen Melissa. She is a connection problem or something.
My hair very messy.
Oh, when Melissa open, chair is disappearing. Tanusha, you can open. You can
No,
just
sir.
right.
Sir, I'm looking very messy.
Just
Sir,
face
ask
only.
Sham to open, sir.
Other people who just 30 seconds only, then you get 10 off.
Can you see?
Why close your camera? Melissa. Wait, check. I cannot see check no more. Melissa, why not open the camera yet? Melissa. Yu, where is Yu? Yu is missing.
So I open.
Yu, Yu.
I open already, so cannot see.
Hey, I cannot see. How can I do it? Yeah, I can see you now. Melissa open, okay. Melissa open, okay. 3%. Melissa.
Melissa.
Oh yeah, and check open. Melissa is so shy. She prepare makeup before open the camera. Melissa, are you doing makeup?
No lah. I don't know why I cannot open it. Wait
Melissa doing makeup like that before opening the camera.
Oh.
Wait, but these are so long. So if you don't want to open, okay. I will.
No, doctor, I don't know why cannot open it.
Okay, no problem. I can set the remaining same MCQ. Now you can turn off your camera now.
Doctor can see me.
Wait,
Can
can
see,
see. I can see now. You are very makeup.
very messy my hair.
Okay,
Really,
no problem.
Okay.
I need to start slide sharing. Wait. You can see my sharing. You can see my sharing. Hello.
Yes, sir.
Can you see?
Yes, sir.
So try to answer number 8. I want to. So you can discuss each other. I will listening your discussion. Yeah, you can. Anyone can try, and if false, anyone can comment why false. I will listening. Number 8. Number 8. True, false. Yes, answer true and false. Okay. Very easy question. This is exam when it's true or false, but I think you can same idea. You can go. What is the MCQ? What we can make? I can create this true false question convert to saying a correct answer, a little bit change and modify the question and stamp. If you know that why the same answer you can answer. The same answer you can choose. So like most embolize clinical silent, I can change like most embolize show clinically significant. So this become false. So true for. Discuss each other. I was just listening only. I will not answer current. So discuss each other. And if other can, if someone to out it other, I'm gonna say it's okay. Accept if other accept true or false, it's okay. Another one, you think true or false. If you think false, you can tell him why false. If you think true, you can accept. So why Susan, you are opening the books.
A is true. B is true. C is true. False.
So how you are adjust each other? You are. I think you you haven't read yet. Sam is already read. Sam most I think most haven't read yet. Sam round of 10 students already okay. I think. 10 or 20, maximum 20 only. They can
What
answer.
is the paradoxical emboli?
Hey, you don't know paradoxical emboli? Paradoxical. What is paradoxical? I think I already discussed in emboli. Paradoxical. Paradoxical reverse, right? Reverse paradox can mean reverse. Mean pulmonary emboli should be came from deviate. But it can come from arterial. Sometimes if they have some head defect, septal defect, mean this can come from head also. Usually pulmonary embolism come from deviate, but they can come from head because of it. Usually cardiac. Not pulmonary. Thromboembolism occur not pulmonary. Other systemic embolism occur via thrombus in the head chamber or head valve. If they have septal defect, this emboli can enter pulmonary circulation and can cause infarct. This is called reverse. Not reverse. I mean opposite. Just deviate the normal rule. So this is quite easy.
I'm not sure. Is it the congestive heart failure or is it right heart failure?
If previously they have heart failure, they can prone to pulmonary infection. This is quite correct, but quite difficult for you. So if you cannot understand this one, okay, this is you understand after heart failure lecture. Because this predisposing factor, heart failure is congestion present in the lungs, so this already defect more prone to infect. This is another concept. If you cannot answer this, okay, the other 4 answers you should answer is okay. This is another concept. Need to correlate with heart failure, and so if you can answer where A, B, C, E is okay. A, B, C, okay, right? Quite easy. Paradoxical, you read but again, paradoxical is they deviate the normal way. Normally, the MLS came from deviate, but now they came from heart because of heart septal defect. Usually, the thrombus from heart usually enter systemic circulation, either in brain, spleen, liver, kidney. Only they will not arrive pulmonary because of left atrium, aorta, systemic pulmonary need right. Usually, if septal defect, thrombus from left can aorta can transfer to right. Sometimes they can deviate the route. Normally come from deviate, but sometimes can come from left head or head thrombus. Usually left head because right head emboli can enter pulmonary also sometimes. So another one correct. So this is correct answer. So number 12 is single correct answer. Just choose one only. 12. So answer is the other way. Other people are so silent. So I need to ask some people who. Melissa, true or false? What? No, not true or false. What is the answer? Wait, Tanusha or G or anyone can. Wait, G is so silent. And also another one, I forgot the name, the case name in the class. I forgot. And second row, usually active student, and second row, I forgot their names. Please try to answer. The case from second row in the class. Vaidehi also so silent. Vaidehi, Satya. Hey, why is too long? Very exam not more than 1 minute. Real exam I should ask like the scenario more difficult. Yesterday, Kahu, I cannot add like scenario long sentence, so I need to short them.
For the question 12 is C, 13 is C also. Is it correct?
So where is your answer for first row group, then second row group? First row in the class group, what is your answer? Second row in the class, what is your answer? Where is Shahu brother? Shahu brother, where's your answer? I forgot his name. No, Hanish. Hanish was not his name. Hanish. Another one.
Harish, doctor.
And Harish. Where is Harish? Harish. Missing Harish. Absent today. Oh. Why Abdullah? So, what is your answer? Why so silent? Oh, too easy, not too difficult. You can, I already tell Sham, you can choose this question also with exclusion method. Exclude, and then one question will left. Usually, I can suggest usually in same question, not all same question. If you are not too sure, you can choose with exclusion method. Not possible when exclude, then one or two question will left. Then one question will left finally. Sometimes the answer is not too correct, but you can choose most possible one. You can exclude most impossible first, but then you can one question will remain for your answer. So, Melissa, what is your answer? Melissa, you. Shan, what is your answer?
For question 12 is C. Question 13 also C.
C. Quite easy only.
Doctor, just now I answered already, but you didn't care.
Cannot hear. So for 14 already answered, I think. This also answer.
Why is it 13 in C? Isn't it B? Hyperplasia?
Yeah, hyperplasia. Prostate, denied PPH.
Yeah, B.
PPH. Same question I know too, so I haven't asked you. Sorry, yes. So what can produce pain in acute inflammation? Chemical media group, you should know. Pain in inflammation. I will not tell the answer. In this case, each other only. Quite easy. Pain in inflammation. Chemical mediators.
Isn't it C? Prostaglandin E.
If you think go through, okay, I will not tell because of this very easy when you should know. If you doubtful, you can search on media later. So you will tell the answer to other. What do you think? I think well, okay, quite easy. So I will move on. This one is not too good.
Doctor, what's the answer?
23. Hey, the answer you should ask the Sham. They will know clearly this answer. Because I will in the class also I usually not get the answer. Otherwise you will rely on answer. You should search from the books. Because all are in the books, quite easy to answer. So number 23. Very easy. Only I will give only 30 seconds. So what is your answer? 30 seconds only.
Interferon gamma.
If you think correct, okay. So 24. Only Shan only trying. Where other people so silent. And Shan yesterday also he got all nearly all correct. Only when Visualization only wrong, right? You wrong, quite easy question. Or you nervous? Visualization, you can see on inflammation earlier sign visualization.
Actually, that question, doctor, I was confused because because I thought it was acute inflammation, chronic inflammation. Because in chronic inflammation, there is six stages, which started with the endothelial contraction.
But
Yeah.
earlier sign, the earlier sign already right. The first and earlier sign is visualization. Initial visualization, right?
Actually, what's the difference between vasodilation, endothelial contraction, and endothelial retraction? Isn't it that all of these things will cause increased permeability of the blood vessel?
Can also cause increased permeability. Endothelial contraction and retraction is to become edema because this cause leakage of fluid to interstitium. Endothelial contraction and retraction is for edema, and also you can transfer the cell. The cell can transfer through via diabetes, but mainly endothelial contraction and retraction mainly for edema. The cell can
so vasodilation is just like an opening a big gap of the endothelial wall.
Gap of the endothelial wall, and then fluid can leakage. Mainly fluid can leakage, so that you can suffer edema.
So early sign of inflammation, either acute or chronic, will be vasodilation.
No, this is mainly features of chronic. Features of chronic you can see from chronic. Chronic, they have new vessel formation, attempts to healing. They can see also because the cells are different. Also, the cells are not neutrophil, lymphocyte.
Not neutrophil.
Little bit different.
Lymphocyte, yeah.
Also, they have you can see some angiogenesis in chronic because they attempt to healing now. Attempt to repair. You can see some features of repair in chronic. This repair feature cannot see in acute.
So there will be a granulation tissue, angiogenesis.
Some can see some can see in chronic because some chronic they attempts to repair now. Acute is some feature. Some can overlap. Like still can be sequence or even acute is a little bit different from chronic. And chronic they have kind of features. Few are different. The cell different. The morphology also different.
Okay.
Okay. You can just know generally. Okay, not too detailed. These are generally in your life. You can just see chronic cell inflammation, chronic sequence like lymphocytes and some angiogenesis can see in some chronic repair after a long duration like this. After you finish general preclinical, clinical, you don't need to know the 2 detail. Clinical more easy. Just know acute and chronic. Acute feature, edema, swelling. Okay, chronic feature, long duration, lymphocyte. This generally remember. Okay. In clinical, you can forget this 2 detail. No need. So 24. What is the answer? Anyone? Where's Abdullah? Where's Abdullah? Abdullah or Danish? Where they are so silent. Harish, no answer at all. So I can consider absent. It's no voice absent only. So 24. I'm calling Harish. What is your answer? Yeah, no answer. So absent. So other one. Where? C, where is C? C is so silent. C and Payong Shan.
Is it
24?
Is it D? Necrotic syndrome.
Anyone can assign it. It's quite easy. So true for a question. Anyone? True for a question 25. Why so long? Then very.
Doctor A is true.
You can discuss. Yeah, you can. Yeah, you can discuss with your. I will not tell us A. So you try to answer A, B, C, D, E. Just finish very fast, very easy. This four question. Who are you? Ahmed. Ahmed, right? This is 27. What is the answer? Sing it correct, actually. 27 is only one answer I need to choose.
B.
B. Who is B? Who are you? Melissa.
Lisa.
B. Oh. Anyone. Sham also B.
Actually, I'm not sure about this. Calcium disease is wrong.
You forgot.
Calcium disease is from gas.
Yeah, calcium disease is for gas, right?
But the fetal mortality can, because it's regarded to pregnant women,
No,
right?
it causes death of the mother, not the fetus.
For this question, you need to understand very well of embryonic fluid embolization, no maternal tissue, fetal tissue. So you can see
fetal tissue.
You can see laryngeal hair in the block at the floor side. So that's how I see DIC.
So the answer is DIC.
You need to answer well for the embryonic maternal. So that yesterday Kahu question, right? You can see the laryngeal hair in at the floor side. Fetal tissue, but can die mother, not child, because of fetal tissue cause embryonic fluid. Embryonic fluid is fetal tissue. If fetal part, right, they embolize in the mother. So mother tissue began DIC, and then mother can die 80% mortality rate. 80% very high mortality if all guys die. But rare. So 28. Choose anyone. One of the following disease is healed by resolution.
It's C. Resolution. Yeah. I think it's C.
Yeah, I also think it's C.
Yeah, C. Correct. Others are healed by scar.
Is it the brain abscess is healed by
abscess scar, right? Brain, brain tissue cannot multiply.
Yeah.
Brain
So
tissue.
it convert into the liquid form, right, doctor?
Then healed by scarring only.
Oh, healed by scar.
Because of brain cannot multiply. Brain scar only. Brain head always scar. They cannot multiply. So 29, 30.
Is it A?
Ah. Very easy answer. What short, what occur most commonly? You need to choose mostly associate. Any short? What is short? You should know definition of short, and this you can answer this only. It's short.
It's C, decreased pulse rate.
Now why decrease pulse rate? Short is the hypotension, increased pulse rate. I think you have not know the clinical is okay. Short is increased pulse rate because of widespread hypotension. Hypotension need cardiac volume. Finally, what is the answer? Still not got it. Anyone? It's very easy. If you generally only thinking what is short.
Is it B, doctor?
Yeah.
B.
G.
B. B.
B.
B is correct. Generally short is cardiovascular collapse only. Mean their cardiac will reduce. Hypotension. Increase pulse rate. This generally show it this only. So 30, who can answer 30? 31. Single correct answer. Oh, why so long? Very easy question. And if I wanna give like number 31 question with Kahoot, so and you're gonna finish within 1 minute. Long. But not too difficult. 31 of 5. You need to choose only 2 from 1 only. So you need speed is in VA exam, you need speed because of some of my question with scenario. I think you have already practiced a micro also with scenario question. But,
31, right, doctor?
30,
Question
31.
30,
31.
31.
Exam, what exam? Concomitant hyperplasia and hypertrophy.
32.
She 30 quite confusing.
Hyperplasia and hypertrophy.
C is wrong. C is hyperplasia. Hypertrophy.
And as put one exam, you need to choose only one.
C is wrong.
They have both hyperplasia and hypertrophy. Concomitant means both.
C is wrong. Is it the D? Uterine growth during pregnancy.
You try. Very error. So anyone. Other people, what is your answer? Only Sham already got the concept. Other people need to know.
Uterine.
C, A, B, C, D. Why?
D.
Melissa, D. I cannot do it so long. Why so long? Pan Shan, what is your answer?
Doctor, I think it's D, right? Because hypertrophy is like you overuse the thing, so it keep on getting bigger and bigger, right? And then hyperplasia is increase in number of cells,
Yeah.
so it gets bigger, right?
Yeah, both are bigger size. Both one is increasing, both are increased size. But there is a difference. Just one is increased size, another one is now this one is increase in size due to both increase in size due to increase in size and increase in number also. So what is the answer? Very easy. So
Easily, doctor.
Uterine growth during pregnancy because the myometrium goes through hypertrophy The endometrium goes through hyperplasia.
Yeah, correct. So 31. 31 is very easy question. You need to choose only 2 from 1 only. Other 2 already it can exclude very easy. 2 can exclude.
Triglyceride.
Yeah? Triglyceride. Okay.
Triglyceride.
So number 32 answer. Little bit, but not too difficult. If you need to know the air fluid level, for me, I finished clinical radiology. I know air fluid level, and I can answer easily after seeing this only. In radiology, clinical, I wanna teach you how radiograph appearance in air fluid level importance during radioactive inflammation. This is quite common in clinical. Air fluid level, I only see this in cancer and radiology. And other clinical feature can apply also. For me, you can rely on other clinical feature. For me, I can rely on radiology alone because of this is for I really learn radiology from Medicare, and so I can apply. But for you, you can rely on clinical features. This one, and this what it is.
Doctor, is it
Abscess
D?
formation.
Yeah, abscess formation. Air fluid level, you can see an abscess in the radiology. You need to know this term in when you have whole life. If they write air fluid level, you can more can tell more abscess is more correct. Carcinoma, they don't have air fluid level. Carcinoma and mass only. Regeneration cannot see. Tropic scar is just scar, cannot see air fluid level also. In liquid only can see AM, fluid, liquid, and FFA. Hypothesis. So 34 embolizing can choose. True only. Only true. Only one.
B.
B.
B. B is true. Patient fat embolizing. Oh my god.
Doctor, D.
No, doctor, no, not B.
No, it's just logically, only 10 can cause fetal embolism. Just consider logically only. Only 10 is nothing. Yes, you can see only you need to choose only 2 A and C. Yes, quite easy. You can exclude one, and this is the answer. The rest is the answer only. So this is common or not?
Amniotic fluid embolism is rare.
So what is the answer? Only one left, right?
So it's D is the only one.
A.
Is it 100 ml, doctor?
100 ml, yeah, not 10. 100 ml.
Okay. So
99%. Most are thromboembolism only. Very few other embolism are quite rare. Most are thrombo. So they call even thromboembolism, not embolism. They use thromboembolism usually because of most embolism 99% thrombus due to thrombus. So they use thromboembolism. I have never seen I see sometimes embryonic, very rare. I have seen my life once only. Thromboembolism is we see frequently. Fat never see. Air never see. So I will send this. I don't know. I will send this one. You can practice this SAM question. I will continue with SAM hematology again. But hematology, I will not send you. I will just send this one only for SAM practice. The keloid, SAM are not too good. For my keloid, is not too good question. So that I have not practiced you. If you, because of this question, I'm not too lying. Take from one book, but I not this question. Keloid question is not too. I need to modify the one else. But you can practice, still practice SAM because the SAM answer are quite even doubtful for me. So if you can just practice what is the predisposing factor for keloid scar via books only. You not rely on this answer. This answer, the answers are not sometimes keloid for keloid is not false. Wrong infection can be true. Fiber can be false, and secondary wrong can be true also sometimes. So little bit sometimes controversy. This so I haven't practiced you keloid scar. Just you see keloid scar from this question, quite a little bit controversy, not too correct. So just read what are the predisposing factors for keloid. No read this time. And this is quite okay. You can read this is correct. Other question. I will continue little bit on hemato. Yes, hemato. Hemato is actually more difficult. So
yes, doctor, a lot difficult.
Yeah.
A lot more difficult.
You do it very challenging. You know term very well. So all are saying a correct answer. You need to choose only one. So number 7, I will choose randomly only because I need to practice run use my question bank a lot of question have. Then I will just to practice same question only. So number 7.
Doctor, I cannot see your slide.
Oh, okay. I need to share. Share screen. Can see? You can see? Hello?
Yeah, can read.
Number 7. Number 7. If you cannot answer, you can look from books later. Number 7. I will ask you easy question only first. Number 7. And number 9. Number 7. Huh? Number 7. What?
Jaundice.
Come on.
Jaundice.
Number 8. You can search later. Number 8 need to search from books. Here 3 through side 6. So number 9. Number 9 is quite easy. Number 9. Sing a correct answer.
Is it C?
Hey, if you wanna choose erythropoiesis decrease, you should consider back. This is what under what category? Hemolytic anemia category, hemophilia reduce or not? Whether reduce hematopoiesis, you can see in leukemia and aplastic anemia and same category only. This is a complete clue for answer. Hemolytic anemia, every time the erythropoiesis never reduce, even increase, right? Even reverse, increase a lot, and ME ratio, minor erythro ratio became reverse. So if you want to choose decrease, you need to consider cancer or aplastic anemia or something only. Hemolytic anemia and not cancers. So even increase, so minor erythroid ratio became reverse. So increase a lot erythropoiesis in. This is pseudocytosis and hemolytic anemia. Hemolytic anemia, erythropoiesis much increase. Because of their main mechanism is not destroy testosterone. They can produce. So quite easy, and you cannot answer. This is increased osmotic fragility. Because spherocytes are not bioconcave shape. Mean when you put this cell in the same concentration, the water can enter, and osmotic fragility mean the RBC can pass very easily because of spherocyte already round shape. Water cannot enter no more, and the cell can pass destroy easily, so increase osmotic fragility. Normal RBC is concave shape, so the water can enter from certain levels. So osmotic fragility in compare with spherocyte is increased because of the already round shape. If a little bit water enter, they can pass easily. So their osmotic fragile is increased. Single correct. This increase MCV not correct. So another one. This one. 11. Single correct. What? Single correct. Okay, not too depressed. I will ask quite easy question in Hemato MCQ. Hemato is quite difficult if you need to understand very deeply. Otherwise, you will cannot answer. For your level, I will ask is generally if you understand. Okay, not too detailedly. So number 11. Number 11.
Doctor, is it B?
Eczema. Anyway, this question is favorite in internal medicine also. So I think this question you should not forward. Internal medicine also this question is favorite. In year 3, year 4, 5, internal medicine one of the favorite condition in hematology, because hematology you will teach again, you will learn again in internal medicine also because we overlap. But mainly specialty hematology is take over by pathologists. Medicine they also learn hematology also a lot. So you will teach again, repeat. You are learning again in hematology in internal medicine also. So 11, so quite so long, very easy. Number A, parvovirus. So I will choose easy question. So number 24, what is your answer? Quite easy. Number 24 and 25. Quite easy. And the thalassemia topic.
Doctor, why never come across phagocytosis? Did we learn before?
Yeah.
I never remember that we learned about spherocytosis.
Hereditary spherocytosis. I think spherocyte. I think include in hemolytic anemia lecture. Hereditary spherocytosis. Maybe I forgot a little bit. Spherocyte include.
I don't think so.
Because same topic. I want to say spherocyte and the spherocyte I teach for
We
power
only learn hemolytic is sickle cell thalassemia, G6PD, warm and cold autoimmune.
And yeah, I cannot teach everything. A little bit I left, and I need to regulate a little bit for MCQ point only, so that I forgot a little bit because too many topics. I skip. Or you need to. And the spherocytosis need to learn for MCQ.
Under normocytic.
Spherocytosis need to learn for MCQ. Spherocytosis need to know. I think I learned hereditary like that topic only. Hereditary spherocytosis. I forgot a little bit. Yeah. Spherocytosis, and then you can learn assignment or something. I forgot a little bit. not from
No,
the
there's no assignment for spherocytosis.
no assignment for spherocytosis, but I think hemolytic anemia features or something, not specific, not direct question, not I don't mention as spherocytosis directly, but this is under hemolytic anemia only, and congenital hemolytic anemia. Not
So just read a bit about spherocytosis.
Spherocytosis, you need to learn a little bit, read from MCQ point like parvovirus, another one, osmotic fragility. This is main point only. If you haven't learned, I'm just think that I teach and now these two main points you need to know. Spherocytosis, osmotic fragility is increased. I think I teach because of this osmotic fragility question I practice in the year 2 also. I'm confused with the year 2.
I don't think I heard about spherocytosis before.
They can answer osmotic fragility question. They can answer. So a little bit confused. I think year 2. I think if you haven't read, I'm just think that a little bit discount here because this MCQ point only because I cannot teach in lecture every topic. Some topic long I can discuss with MCQ point in some topic. So spherocytosis main point you need to know two main point only. Spherocytosis in predicate. I think I will give you predicate. I predicate include spherocytosis. Predicate. I will set predicate slide today. You can read right in advance. I will teach later. I need to show slides in the predicate room also. After MCQ live, I will take one time, maybe evening, to take one predicate lecture for hematology, and I need to show some slides on neoplasia. And then I will give you PowerPoint first. You can write in your logbook first. Then spherocytosis include in predicate, and you can learn from predicate also. So main 2 points, spherocytosis is due to genetic defect. This can cause osmotic fragility. This parvovirus infection can cause aplastic crisis. But this question you can learn from aplastic anemia also. Not only from spherocytosis, you can learn reverse. You have aplastic anemia lecture seminar, right? Aplastic anemia seminar. This point already included in aplastic anemia seminar, so you can use in both way. You can apply from aplastic anemia also this point. If I haven't teach, let's see, I haven't teach spherocytosis, but you can apply this infection from aplastic anemia seminar because of this include already this point. The causes of aplastic anemia and their relation. Aplastic crisis. You can learn from aplastic anemia also. But hematology like that, you can overlap. Thalassemia, osmotic fragility, you can learn from thalassemia also. Thalassemia also osmotic fragility test. Thalassemia is not increased, reduced, I think, because of the assay are small. But not too sure about thalassemia. Not significant. Here, spherocytosis is significant. Spherocyte can cause increased osmotic fragility because they are round cell, and then they cannot resist water. You need to learn confirmation test also. So another one. This one. Previously I forgot what is my question. So number 24, 25. What is the answer? 24, 25. It's under thalassemia only.
Uh, 24 is C.
And C. And C, okay. Okay or no? No, C. D. Thalassemia hemoglobin F level is increased.
B.
D is correct. We got reduce. Because thalassemia have a lot of iron, so no need to increase iron gamma binding capacity. Reduce only. Not raise, reduce. Hemoglobin F increase in thalassemia, correct. For thalassemia, they have no alpha, no reduce in beta chain or alpha chain, so
Yeah, total iron binding.
F level is increased. Thalassemia is generally correct. So electrophoresis will be what is correct. This is a little bit controversial. Mainly, I get which give the answer. Most correct decrease hemoglobin A. Hemoglobin F should be increased. A2 is depends on people type, not too sure. A is decreased. Increase hemoglobin H is no. So reducing hemoglobin A level in thalassemia. Just know the main point. Or I can change increase hemoglobin F also correct. So main antibody type what type?
IgG. IgG.
IgT. Sorry, I think I have a scare a little bit, but many topics I cannot cover everything also. So you need to learn some point like what is the. I'm now telling you now. Everyone, not only everyone. Spirocytosis need to read for MCQ only. For what spirocytosis, what need to know aplastic crisis. What is the confirmation test, and what is another one? What's another one? Or osmotic fragility test. This three need to know. Others no need. Just prefer it only need to know. Spirocytosis not too common in clinic, but you will learn this spirocytosis where as in I will give you slides predicate include spirocytosis. And then I haven't issued predicate yet, so I forgot. Predicate spirocytosis including predicate slides. Sorry, little bit. So contact positive in what? Let's need to know. Very easy. Contact positive in what? Very easy. Contact positive in
B.
34.
B. Is it?
B or D? Home test is positive in. Hey, why so long? B or D? Or C? Because I cannot clear your advice. B or D? Or C or A?
It's D.
Yeah?
Immunohemolytic anemia. Or is it not?
D.
D, correct. Only MU positive home test. These are not MU. They are site RBC shape abnormality, and this is beta hemoglobin affair. So home test is positive or antibody. MU only. This is size. This is sickle cell also RBC pattern only. Check. Thalassemia also is hemoglobin effect. So WBC. So number 4 question. Only one correct. Number 4 and number 5. These two are very easy and must know.
Doctor, number 4D.
Number 4. What answer?
Hodgkin lymphoma.
Yeah, correct. 5.
Allergy disorder.
Allergy disorder. Oh,
No.
this is allergy disorder. Oh my god. You are concerned.
The myeloid leukemia.
Myeloid leukemia. So number 2. Some questions are difficult, so I'm not mentioning. Just some, if you have some idea, okay. So number 2, quite easy question. Number 2, I cannot ask you too difficult question. Number 2 is for you learn via online only quite difficult for you. So if I can teach you face to face, like I can ask more difficult question, but I can pity you because of online class quite difficulty and
Down syndrome.
What syndrome?
Down.
Correct. Quite easy. You can search later this monoclonal antibody for AML and ALL. You can learn from your video, or you can take picture and then you can search answer later. Monoclonal antibody you should know for AML and ALL. Another one, this one I will teach some interesting point only. Number 11, what's the answer? 11.
B, T821.
Okay. And 3.
Wait. EML.
EML and 3.
M3V.
C.
A. Why C?
C is CML.
Not CLL, CML.
C is chronic myeloid.
CML and ELL, 922. Lymphoid pattern. Oh, this one. 5070. Kuruma no ni now ELL. This one I will tell, and you need to know this one. Number 3, this positive. This is memorizing only. I cannot explain. Pre-B, PTR, TDD positive. You should know also in clinical. So I will teach this point. So oral roads are found what way? Oral roads are found in Hey, very easy question. Why so silent? Oral roads are found in cytoplasm and what cell?
Myeloblast.
Yeah, correct. Myeloblast, myeloid leukemia. Oh, no MTS, just MS6. Hey, MS is very easy.
Starry Sky.
Yeah, steady sky. Yes. Okay. I will stop now. Just for practice only because some practice. If you have some idea, okay, I will come to you. I will need to modify the question also later. But yeah, you have. You are lucky. Currently, no exam. Yeah. So okay, I can change my question again because it depends on your exam. If online exam more shorter, if face-to-face exam, the question we can do more longer. Uh, so just read. So pathology now finish, but I still need to teach after MOC live. I will take 1 or 2 time for predicate and some discussion again, some MCQ again. Okay. I think after reading everything, you will be moved. But hematology, I can understand because hematology is quite difficult for you. If you understand basically, must know things only understand. Okay, no need too detail for you because you within short time, hematology is the major subject. I can understand you can quite difficult to answer MCQ in some matter. But even this MCQ are quite. For me, this is level 2, bronze level 2, quite easy and only. If I assess scenario in hematology, will be more difficult. So, sham, spherocytosis, you can read for the point I have told you, and then I will send within this weekend for predicate for hematology. You can write in your books, logbook first, then I will teach in after MCU live for hematology predicate and neoplasia slides predicate, and then I will practice some MCU can face to face is more better. Okay, this is just I will give some idea for MCQ only. So finish episode. See you again after MCU live. So good luck. Okay, bye.
Thank you, Bye.
Bye. Any question you can ask
Thank you,
via
Doctor.
first and message. I can reply.
Thank you, Doctor.
Okay,
Okay.
doctor.
I will practice again MCQ after MCU live. MCU face to face mode, so I can ask face to face individual. Now I can assess quite difficult. Only some student only respond. So okay, bye.